Hi everyone, this is Dr. Priyanka Mehta, gynecologist and laparoscopic surgeon from Apollo Women's Hospital, Chennai. In this video, we're going to be talking about what is hysteroscopy and laparoscopy. So if you have been either trying for a baby for some time or you have some gynec problems, you probably would have heard advice of hysteroscopy and laparoscopy. So to make it simple for you to understand, hysteroscopy means it is divided as hystero means the uterus and scopy means visualizing or looking at it through a telescope. And laparoscopy means lapro is the abdomen and scopy is to look inside it with the help of a telescope. So basically these are new techniques. These are minimally invasive techniques. That means that you just need to stay in the hospital for maybe daycare. That means just half a day or just for one day in the hospital. And we do these procedures because of certain reasons. So if you have been trying for a baby, so if it is been advised for infertility, then usually when we do hysteroscopy, in hysteroscopy, we look inside the uterus, we look into the endometrial cavity. If you can see here clearly, we kind of look inside the uterus, so the endometrial cavity. If sometimes there is a diagnosis of a thick endometrium, a polyp in the endometrium, a small fibroid in the endometrium, which can prevent you from getting pregnant. So then we do a hysteroscopy and at the same time we can do the treatment for it. So normally the uterus is in a closed kind of a form, and when we do the hysteroscopy, then we usually inject some saline into your uterus so that the uterus will expand, and then we're able to insert this very fine camera on a telescope which is just 3 millimeters, and it usually goes in through this vagina, and then it goes inside this cervix. It's 3 millimeter camera, and through video monitor we are able to visualize and we're able to see inside the endometrium or inside the uterus as to what is the problem, and if everything is normal, then that is good. We are also able to see when we are doing a hysteroscopy for infertility. So if you can see, when we go inside here, we're able to see the openings of the fallopian tubes on both sides, which is called the ostia. And if there is a blockage there, which could be preventing you from getting pregnant, sometimes you can have just thin adhesions, as we call it, or some kind of block there. We can do, we call it cannulation, or we just pass in again one very thin plastic tube so that if there is a blockage there, we're able to clear that. Now, this was about hysteroscopy. In laparoscopy, lapro means the abdomen and scopy is to look inside with a telescope. So we look inside the abdomen mainly for the purpose of looking at the uterus, the tubes and the ovaries. So again, to make it simple, the uterus could be having, we want to see what is the problem, because we have done ultrasound, we can pick up some problems, but sometimes only when we look at the uterus, we're able to understand what exactly the reason is why you're not getting pregnant. Or if you have been diagnosed with a fibroid or with an adenomyoma, which are tumors of the uterus, or on the ovary there could be endometriotic cyst, there could be some fallopian tube cyst, there could be PCOS or polycystic ovarian syndrome. So we can confirm the diagnosis and we can also do the treatment. So what are the different treatments that we can do? So we don't just look at the problem, which is called a diagnostic laparoscopy, but we can also do a treatment. So operative laparoscopy. So if there is a fibroid, say more than 4 centimeters, and that is causing symptoms of pain and bleeding, or if it is preventing you from getting pregnant, we can do a myomectomy, whereby we don't remove the uterus, but we just remove that fibroid. Similarly, sometimes there is an endometriotic cyst in the ovary where a lot of blood is collecting inside the ovary, and that can either cause a lot of pain, that can cause dyspareunia, pain during intercourse, heavy bleeding, or infertility, difficulty in getting pregnant. So we can remove that cyst also during the laparoscopy. The problem of endometriosis, where a lot of blood keeps collecting outside the uterus. You can also have small implants inside the tummy or the abdomen, and all that blood lesions also can be removed during the laparoscopy. Another reason for which we do the laparoscopy is for infertility. If we want to understand if there is a block in the tube, so what we do is we take around 200 ml of dye, which is blue in color, which is called methylene blue, and we will hold the lower part of the uterus, which is called the cervix, and then we push in this blue color dye which goes through here. And if this is a patent tube, so there is no block here, the dye will come out from here, go throughout the entire tube, and then this part of the fallopian tube is broad and it will open into the abdomen. So on both sides we are able to see that the dye is coming out, so that is methylene blue is coming out, and that means that the tubes are patent, we say, or there is no blockage in the tubes. And then that means that if this was a reason for which you were not getting pregnant, that block is removed. And if we are able to see that the tubes are clear, then we can proceed for the further treatment if you would need for getting pregnant, such as IUI. So it is important that when we have done the basic investigations for infertility, you have been trying and we are not able to understand, or there is a diagnosis of either endometriosis, an ovarian cyst, a fibroid, a PCOD, adenomyosis, and this could be the reason for the infertility, or we have to evaluate the inside the uterus or outside, what is the problem, why you're not getting pregnant. A hysteroscopy, laparoscopy is a good surgical technique which is done as a daycare procedure, and with this we are able to understand as to why you're not getting pregnant and what is the best treatment that we can do for you. So at the same sitting, when we also confirm the diagnosis, we can also give the treatment for the same. And after this hysteroscopy, laparoscopy, in fact, the chance of pregnancy, once we have corrected the problem, improves by almost 50 to 60%. So there are other reasons also for which we do hysteroscopy and laparoscopy. We will be discussing in the coming videos. Like for hysteroscopy, we can actually even sometimes there are these adhesions inside the uterine cavity. So inside the uterus, sometimes there could be a kind of an adhesion, or there is not enough space because the walls have got stuck together. So we can also, with very fine hysteroscopy scissors, remove that blockage, either at the entrance or inside the uterus where there is a blockage, or where there is these adhesions, or these walls have come together and they are not separating, and there is something which is sticking, making both the walls of the uterus to stick to each other. Those are called adhesions. So we are able to release that too. And also laparoscopy is used for removing the fibroids, called myomectomy. It is also used for removing the uterus, called hysterectomy. We will be discussing shortly in some other videos. So thank you and take care, and thank you for watching.